Hello and welcome to the Westchester County Association's countdown to the second annual Healthcare Reform Summit on September 26th. I'm Bob Knight, and this morning on this live webcast we're going to be discussing the changes that are ahead with the Affordable Care Act. The Supreme Court handed down its decision last week, and today we're going to be discussing the impact on business and on the healthcare provider community. Joining us this morning is Nancy Taylor, the co-chair of Health and FDA Business Practice at Greenberg Traurig in Washington, D.C. She's also the former Health Policy Director for the Senate Committee on Labor and Human Resources. Good morning, Nancy. Thank you for being with us.
Thank you.
And also to my left is Russ Carpentieri, Managing Director and Partner at Opus Advisory Group.
Good morning.
Good to see you, Russ,
Thank you.
as well. So, first question, Nancy. It's been a busy week. I think many in Washington were a little bit surprised by the Supreme Court's decision.
Yeah, I agree that many people were surprised about the Supreme Court decision. It was a 5-4 decision. The law for it almost in its entirety was upheld, where the Chief Justice found that the individual mandate to have health insurance coverage would have violated the Commerce Clause if it had been drafted differently, and would have been held unconstitutional, and would have been held unconstitutional under the Constitution if it was evaluated under the Necessary and Proper Clause. But because it was drafted as a penalty, which is enforced through the tax code, he said it was constitutional under the taxing authority of the Constitution, and therefore was upheld. There was only one provision of the law that wasn't upheld, and that related to the Medicaid expansion provisions, where Medicaid there's a requirement on every state to expand eligibility for Medicaid to 133% of the federal poverty level, regardless of whether or not it's a male, female, or a family member. And the enforcement of that was if a state did not extend to 133% of poverty, then they could lose all their Medicaid funding. And the judges upheld the Medicaid expansion, but said that the enforcement was too strict, and therefore found that portion of the law unconstitutional. But for the most part, the law is intact. There's a lot of issues to be complied with. Many employers today have complied with some of the requirements, and so people are moving on and understanding the law better.
Great. And we're here today to have, obviously, an apolitical discussion. The decision has been handed down, so now it's how do businesses prepare for the Affordable Care Act, which will be rolling out. And Russ, you've heard from a number of your clients.
Yeah, there's definitely been an uptick in activity where people have gone from kind of a wait-and-see attitude to I need to move into a strategy. So, I think most of us who are in the industry believe that so many people had kind of sat back and hoped that this would have gone away. And now that that's not the case, the inquiries about what do we do, what do we need to be aware of, and how do we start to prepare are certainly, coming to the forefront. So we're seeing a lot of people, again, asking what, in fact, they need to do. And it's really broken down into two components. There's a compliance component where there's procedures and things that need to be done in order to adhere to the law. But then there's a financial decision that has to be made in 2014, and that's where most employers are concerned about what is the impact to their bottom line relative to the benefit offerings that they have.